Well, good morning. My name is Warren Limmer. I'm state senator and also chairman of the Judiciary Committee here in the Minnesota Senate. I want to thank you for showing up this morning at 8:30 on a Monday morning. I'm honored to welcome Congresswoman Michele Bachmann back to the state capitol. As many people know, Congressman Bachmann, as well as a number of legislators, are very concerned about where the state is going in reference to the early MA enrollment that the governor has just recently signed us up to. There was questions, as you know, about the constitutionality of such a movement by this governor. And then, despite that, he even quickly revved up the timetable for early enrollment. We had thought that perhaps August or September was going to be the day or the month that MA would be early enrolled into that portion of Obamacare. That has been moved up to March 1st by an executive order by the governor. Now, you may recall we had a press conference here about a week and a half ago about a letter that I had sent to the governor about the constitutionality concerns that we've had with the early authority given to him by the past legislature. Many of us believe that's unconstitutional. You cannot commit a future legislator on the actions of the last legislature. And despite that, even if the governor did sign an early enrollment in MA, that triggers present-day budgets that need to be passed not by the executive branch, but by the Minnesota legislature. The legislature has the power of the purse in this state, and the governor does not, despite any authority that he thinks he may have. I'm going to pause at this time. I'm going to introduce Michele Bachmann to you, and then we'll hold for questions, and other legislators also have some opportunity, or give them an opportunity if they wish to speak as well. Congresswoman Bachmann.
Thank you. Thank you, Senator Limmer, and thank you all for coming this morning. There's an old phrase that says, when you're in a deep financial hole, stop digging. And as you know, Minnesota is in a $6 billion financial hole right now. And unfortunately, our new governor, Mark Dayton, who is a good man, he is not we're not here to say that he's a bad individual. We just simply think that he's wrong about his prescription for where Minnesota needs to go. Made a statement that I thought was fairly remarkable last week. He made a statement in the paper by saying, repeal of Obamacare would be catastrophic for the citizens of our state. He went on to say that he is seeking to expand Medicaid for an additional 95,000 Minnesotans and extend the deadline to apply for a $1 million health exchange grant, which our Health and Human Services Secretary suggested is in the works. Well, this is an extraordinary statement. The governor, in one of his very first acts as governor, when the state is in a $6 billion hole, seeks to put an additional 95,000 people in this state on the welfare system at a time when we're constrained to support those who are already on the system. And if he is doing it for the reason of applying for an additional $1 million grant, if you do the math, that means that each one of these recipients would be receiving about $10, a little bit more than $10. That wouldn't even pay for a morning's worth of health care for those 95,000 additional people on Medicare. This is an extraordinary move on the part of our new governor to have this be his opening signature statement to seek to add almost 100,000 new people to Minnesota's already overburdened welfare rolls. And so the reason that I'm here this morning with my colleagues from the Minnesota State Legislature is to call on Governor Dayton to heed his own advice. Because last week, when these same lawmakers put out plans to reduce spending and to reduce the size of government here in Minnesota, as they wisely needed to do, Governor Dayton said that he wished that they would take their time. He also said the matter was marked by complexity and needed more time for talk. And this is the same governor who on the third day of office signed the executive order that expands Medicaid, Medicaid assistance, ensnaring the state in Obamacare, and will cost us millions upon millions of additional dollars that we don't have in Minnesota. All across the country, we're seeing Obamacare is driving up health care costs. Insurance premiums are rising. Bureaucrats are starting a process that will expand the list of minimum benefits insurance companies must offer, and that will raise the price of health insurance, and worse, it will take away consumer choice here in this state. Small businesses are fearing that these mandates and penalties of Obamacare will drive up their expenses. We're already seeing that happen with private insurance premiums, or make it impossible for small business owners to provide health coverage for workers, forcing them ultimately into government-run health care. I saw that when I did a tour of small restaurant owners who were busy trying to cull their rolls so they would have fewer than 50 employees on their employment records. Last week in Washington, our House of Representatives took a bipartisan vote to repeal Obamacare. At the same time, more than half the states in our country, 27, Iowa being the latest, are suing the federal government over the constitutionality of Obamacare. Very serious steps are being taken to stop this job-destroying legislation that will cause health care costs to rise exponentially. Yet here in this state, our governor, Governor Dayton, is unyielding in his desire to fully commit our state to it. In fact, he's wanting to make an already very difficult problem worse in this state by adding even more people to the welfare rolls. We're here this morning to call on Governor Dayton to change course. If Governor Dayton truly believes that cutting spending and shrinking the size of the government are complex issues, then how can he not at least withdraw his executive order? And that's what we're here to do this morning. We're calling on Governor Dayton to withdraw his executive order, sit down with these lawmakers who are only too willing to discuss with Governor Dayton what we can do to work this issue out, and work on the kind of bipartisan health care solution that will not add to our state's $6 billion deficit. Obamacare is already raising insurance premiums. It will raise taxes. It will raise taxes for people in Minnesota. It will gut the Medicare Advantage program, which many people in Minnesota take advantage of, and it will rob the people of our state of the choice to buy the kind of health insurance that is best for them and for their families. The time has come to fully repeal Obamacare, and we may need to take extraordinary actions together in order to see this happen in the next 2 years. And I yield back to Senator Limmer.
Do any of you want to make any statements? Go ahead. Identify yourself.
Yeah, I'm State Representative Bob Detmer from Senate District 52A, and I just want to represent the people that I represent in Senate District 52A, and the majority of those people say we need to look at what we do in here in Minnesota because it works, and not take on the health care that is put onto us by Washington, D.C. And just a quick story. I had breakfast a few months ago with Anderson Windows, the CEO and the president of Anderson Windows. It's always been a Minnesota company, and for the last 20 or about 2 years now, they have reduced their employees down from 15,000 people down to 10,000 people company-wide. And I've talked to some of my constituents that work at Anderson Windows. With the new health care coming out of Washington, D.C., it's going to cost Anderson Windows a lot of money, and for the past 3 Christmases now, they have not gotten their Christmas bonuses. Again, we need to look at what we're doing in Minnesota. We're doing good things in Minnesota, and thank you, Congresswoman Bachmann, for coming back to your home state and representing the people here. Thank you.
I'm Senator Gretchen Hoffman from Senate District 10, and I represent a district that's on the border with North Dakota. And I've spoken to many of my health care providers in my district, public and private health care providers. And the one thing they see coming from this, and that I'm very concerned with, is that we have no residency requirement with Governor Dayton's early opt-in to Medicaid. And when you live on a border state like I do, or my district is, people are going to flood to Minnesota. My counties are already struggling with the poverty that has risen because of how easy our system's to get. We're going to add another 100,000 people, and I think, frankly, that's a low estimate. So I'm standing with Senator Limmer, questioning the constitutionality of this movement of Governor Dayton's, and I also question the wisdom of it. I agree with Congresswoman Bachmann that Governor Dayton is a very nice man. I've met him, but he is wrong about this. We can't add more people to a system that's already overburdened, and that's, I guess, where my people in my district stand, and that's been across the aisles all over the district. They're begging for this not to happen to Minnesota.
Representative Bruce Anderson from House District 19A, representing most of Wright County. Just here to re-echo what the citizens of my district and the state of Minnesota said in putting a new majority, not only in the House and the Senate, was we're tired of spending money we don't have. And money that we are bringing in right now is about $32 billion in income revenue. And to continue this and to force our hand, as President Obama did with the healthcare issue, and then for our governor to continue this puts us in a dire strait. And we can't continue this financially on this state. And Americans and also the citizens of Minnesota have said no more spending the way we're going. And this will just proliferate and put forward more and more what we don't have, and I appreciate the opportunity.
Good morning. I'm Ted Lilly, Senator from Senate District 56. And quality health care, world-class health care that we have had in Minnesota comes best when you have a relationship with your care provider directly. It's between the patient and the care provider. And when government steps in between and puts roadblocks between that process, the quality of health care can be reduced and impacted. Many employers across the state and across the country have already had to give out notices to their employees that health care has been changed. If we have health savings plans in January, we had to send in a note to our employees that we are rationing health care, that we are cutting back on what is available to them as far as coverage. So some of the things that have been covered by health savings plans in the past are no longer covered. And those are the types of things that employees and that constituents are concerned about in this new health program. So we need to be careful what we are doing, and I support Senator Limmer and Congresswoman Bachmann in this effort. Thank you.
I just want to add one more thing. With Obamacare, it's becoming more and more clear what we bought in this health care overhaul is one of the largest bureaucracies America will ever see. We have a chart that is, I apologize for how small the font is. It almost looks like the font in the tax code. But if you look at this healthcare chart, there are 1,950 new regulations that will have to be written under Obamacare. Now, if you consider 32 million new people will go into the healthcare system, but no new doctors, no new nurses, and only the financial resources that we already have. So what this means is we'll have to be spending trillions of dollars more for this system, but what we're really getting is not more health care, we're getting one of the largest bureaucracies that we will ever see in the United States. That's what we're buying in all of this. It will mean more hassle, more expense, but not necessarily more or better quality health care.
Question, Representative?
Okay. We'll give you a little time. I've just got a little conclusion comment. The legislators and public policymakers in Minnesota are somewhat perplexed by the governor speeding up the early enrollment in MA and the Obama health care program. As you heard, residency requirements are not required in the state of Minnesota. Only a few short years ago, we had a problem with welfare payments being given without residency requirements. I believe that still is in existence in the state of Minnesota, and we've seen a number of people coming from all over the country to take advantage of our generosity. This is going to happen again. But keep in mind, there's only 2 states, 11 states qualify for early enrollment in Obamacare. 2 states have signed onto it. Now that Obamacare is beginning to reveal itself and all of the bureaucracy that's involved and the cost involved, 9 of those 11 states have not taken advantage of early enrollment. But Minnesota seems to want to lead the nation once again during a time when they can ill afford a new program There's $6 billion in debt that we have to wrestle with. The governor is now committing the state into even more expenses in order to partner with Obamacare. Obamacare is not a free program. And nevertheless, without residency requirements, we believe that Minnesota will become a magnet state again. And that will trigger even more costs onto the state during a time when we barely can afford our own budget at the current time. We believe that the Obamacare program that the governor has now roped us into is going to be disastrous to the state of Minnesota, and it's going to be extremely difficult to balance our budget in a very difficult year. We'll stand for questions now.
Governor Dayton made this a priority during his campaign and did this quickly and has made no indication that he is going to reverse course on this. If he doesn't change his mind, what action are you hoping, or what are you trying to accomplish if he doesn't change course?
Well, let's put things in its proper perspective. The governor says he wants to enroll Minnesota in Obamacare. Will there be enough federal money from Congress in order to initiate Obamacare? I don't. We have a Congresswoman here that might be able to say a few words on that. And second, during a time of budget constraints, I'm not sure if the legislature can commit a whole lot to it, despite what the governor in the executive corner is trying to commit us to. So, and of course, there's always a legal option that someone, a citizen of the state of Minnesota, a taxpayer, may wish to just take on the governor in court because of its potential of being unconstitutional, the authority that he was giving.
Do you plan to file a lawsuit?
Not at this time.
We're on a collision course with reality right now, and that the reality is that the state's bank account is in the red. The same with the federal government's bank account. It's in the red. And so we're in no position to be able to afford to the expansive view of government with adding even more welfare programs, which is exactly what Governor Dayton is trying to do right now. We just took a historic vote last Wednesday in the House of Representatives to repeal Obamacare. There is no effort that I see afoot in the House of Representatives to fund Obamacare in any part or measure. So it's important for people in Minnesota to consider that right now Governor Dayton is wanting to commit Minnesota taxpayers to add even more welfare recipients to the welfare rolls at a very great cost, but it will be at a great cost for Minnesotans without necessarily money coming from the federal government to pay for those costs. This will be a very bad bargain for an already overburdened, overtaxed state.
Would you both then disagree with the conclusion by the Department of Human Services here under Pawlenty that there will be a wash? The cost is a wash for Minnesota, that the cost of expanding, the early expansion is the same as it would have been with the commitment the state had for Minnesota Care, for those under Minnesota Care, and for GAMC.
Well, some of the early costs that we've begun to estimate, that for the fiscal year 2011, the cost of MA early enrollment in Obamacare just for this year would be a little over $26 million. That's a net increase to what we do now. The cost for 2012 through 13 goes up significantly, and that's projected right now at a net increase of $188 million. And after full implementation of Obamacare, 2014 and further, I'm not sure if anyone can estimate it now. But it certainly is in excess of $188 million a net increase. I have one figure that says, and we do expect that there'll be a larger number of enrollees into the program, and that will leave the state with a net general fund cost of $384 million sometime after 2012. So any way you slice it, the costs will continue to go up through the years as we get closer to full implementation, and then it will even be more cost after that time as this state continues to go on the path of being a partner with President Obama and Governor Dayton in enrolling in Obamacare.
Senator, I'm curious about your position that no legislature is bound to what a previous legislature has done.
That's right.
Does that mean we start at zero every legislative session? Every law that Minnesota has is irrelevant at the beginning of each new session?
No, law is different. However, any existing state statute is subject to repeal by any legislature in the future. So we are not bound, any future legislator is not bound by the actions of the past. We have that discussion continuously in the Judiciary Committee as well on the floor of the Senate, and I used to be in the House, and that's a common theme that's discussed regularly in this state capitol.
Are you guys taking issue with this specific portion of the federal health legislation, or do you see a consistency argument with the legislation moving through on the federal tax conformity as it relates to the dependent coverage for up to 26? I mean, that's moving through the Minnesota Capitol now. Would you oppose that on the same grounds that that's moving Minnesota more toward embracing?
If this is a legislative question, I haven't studied the 26-year-old issue enough to make a comment on that. I do know that a 26-year-old is eligible for his parents' insurance coverage once Obamacare is established. I do know that, but I'm unsure of how it's working in the state legislature. I haven't seen any legislation to that effect yet.
What would you advise your colleagues at the state level? Should they not even do the conformity to signal any embrace at all of the federal health legislation?
Well, this provision in Obamacare, to be clear, goes up until a person reaches their 27th birthday. So a person is 27 years old and they can still remain on their parents' health insurance. That doesn't come without a cost. And if you look at the handout that we gave you, there's an answer on regarding the costs that are involved. It appears that it may be $300 a year in addition that will be added on to the cost of the parents' insurance policy. Also, I believe as a part of the response to that question, parents may not be able to opt out. They may be forced to put their child on. The other provision is that now in Minnesota, there are because of Obamacare and the high costs associated with it, no insurance company in Minnesota any longer offers any child-only policies. And it's because it would break the bank of the insurance companies to do so. And it's clear, all of these provisions that come in, they aren't free. They come at a cost. The question is, who will pay the cost? We know that the Minnesota legislature will be burdened with substantial increased costs, but so will the people that are paying the premiums now. In essence, the bottom line will be the people who are paying health care costs now will just be increasing their payments in the future. So the final result of Obamacare will be it will cost more and people will end up getting less. I mean, what a deal. This is why people are opposing Obamacare, because it costs more and you get less.
So should the state of Minnesota decline conformity on that specific portion?
I think that the legislature will make that decision about what they want to do, but my point here today is to say that this provision is not free. It comes at a cost. And I think we need to very carefully consider and think about what this means. We can do so much better than this. That's what we need to think bigger than this. We can do so much better if we adopt free market policies in healthcare. Because the real problem here in healthcare are the cost drivers. And what we need to be able to do is attack the cost drivers. Obamacare has nothing to do with bringing down costs. It will not bring down costs. Again, if you read the handout that we gave you, clearly Obamacare is going to cost individuals and state legislatures substantial increases in money. Let's let science and technology lead the way in healthcare and free market innovations in delivering quality of care. Government, I don't think it's any shock for anyone to realize that government is not the most efficient distributor of health care, and that's what Obamacare seeks to do.
Can we do one more?
Congresswoman, in your comments earlier, it seemed like you said that you're going to take some type of action about this executive order. Maybe I misunderstood, but what type of action are you talking about? You're talking about legal action in courts? You're talking about action in Congress? What?
In the immediate, we're asking, you mean Governor Dayton's executive order?
Yeah.
In the immediate, we're asking Governor Dayton to withdraw that executive order. He does not have to go forward with it. We think it is a mistake. And in light of his comments last week, when this legislature, in an attempt to be responsible with the people's money, said, let's take time, let's sit down, let's talk about this, Governor Dayton wanted to tell the legislature to slow down on cutting government spending, and that's all we're saying is, Governor Dayton, slow down, be consistent in your remarks. If you think that we should be careful and be deliberate about talking, then I think it would be prudent for the governor to sit down with both House and Senate and talk about how they can truly have a responsible budget.
It sounded like you were saying that somebody need to take action beyond that.
Extraordinary action was the term you used.
Yeah, so what type of action are you talking about besides asking him to do something? That's a little action. What's extraordinary coming up? What do you expect?
Well, the legislature will have to make decisions about the budget because they are under the requirement to balance the budget. And if Governor Dayton wants to continue to put a priority on adding to an already expansive welfare role, that will make decisions very difficult for my colleagues who stand behind me because they'll have to find cuts elsewhere. And again, Minnesota is one of the top, if not the top, state in the nation for offering welfare benefits. To expand that even more then takes away options from the legislature to balance their budget. And that's
you're not talking about lawsuits or anything, right?
That may be a possibility in the future, but right now I think it would be prudent if Governor Dayton would put a hold on his executive order on early implementation in Minnesota because of what Senator Limmer had stated. Only 2 states in the nation have decided to go with early implementation. Minnesota is in a very difficult place, being $6 billion in the hole right now in the red. And so to make the problem worse doesn't seem like a prudent move on the part of the governor.
So the bottom line is your message is the same as it was a week and a half ago to the governor to rescind his action.
We tried to warn the governor of the unconstitutionality of his action, his authority in this regard. That was our first message.
Right.
Second message is, now that we're beginning to see the costs outlined, as I said before, this is a tremendous cost onto a very difficult budgeting year. Yeah, with a $6 billion problem, adding this much money that has tremendous tail costs into the future is really going to make our job extremely difficult.
Tremendous tail costs after the federal government stops paying the 100%.
Well, it just steps up every year from this year, and it keeps stepping up and stepping up. And it's
the federal government won't be paying 100%.
One of your points is that the money is not there from the federal government to meet that obligation. That's one of your points?
Well, I think the federal government, the members in Congress, it's doubtful that there will be payment for Obamacare. And in the legislature, with a difficult situation that we're now facing, it just makes our job even more difficult. Now, this governor doesn't have any qualms in raising taxes, in claiming that that's how he's going to balance the budget, but now he's adding even more cost onto that budget. And I suppose that just means that he'll cure it the same old way. We'll just go back to the people and tax them more. We're definitely in a showdown approach with the governor. I think that ends it today.
Thank you.
Thank you.
You.